there. Do you want to come with me?
Yes.
Hi, my name's Amy, one of the assistants here.
How long would it take?
Not very long at all, about 5-10 minutes. Do you want to come on in here?
Okay, thank you.
No worries. You can take a seat, please, in the corner.
So, Maureen, you've had your biopsy now, and I said I'd just explain what I think and what's been going on here. I told you that we found a small lump in your breast on the screening mammograms, and we've had a good look at it now. And I have to say, I'm really very suspicious that this will turn out to be a small breast cancer.
What's going to happen next?
Well, we're finished. You're finished now. There's nothing else that we need to do today. You're going to come back next week. I'm telling you what I think because when you come back, you need to be prepared to, if this is breast cancer. I'm a radiologist, and what we'll do is we'll pass you on to our breast surgeons who will see you with the result of the biopsy and then discuss everything with you, and they'll explain exactly what the best treatment is. It's a bit early now to go into any detail about treatment. If you have breast cancer, your chances of surviving breast cancer are infinitely greater than they were even 30 years ago. You've almost got double the chance of surviving it.
Of all the many women who get breast cancer, most of them, it never comes back. And they carry on, live long, healthy, happy lives despite having had breast cancer.
We are being able to give treatments in a way that reduces side effects considerably, and so patients are able to get back to some normality much quicker after their treatment.
You're not only resecting cancer, but you're also focusing on the aesthetic outcome so that you don't deform your ladies as far as possible. They can go out with their children, swimming, they can enjoy their holidays and try to forget once the cancer treatment is over that they ever had cancer. Hi, my name is P.G. Roy.
Nice to meet you.
Hi, Thanks. Have a seat, please. You came to the clinic last week to see my colleague about a lump, which was biopsied. I don't have good news for you. I'm really sorry about that. It is a small cancer in your breast. So through the entire treatment, you will be supported by Ginny, who will be your key worker. She'll be your first point of contact. You'll have your contact details for her, and you can email her or ring her so that she can answer your questions or point in the right direction. Basically, she'll be your assistance through the treatment.
So we need to do a bone MRI.
Yep. And this CT was 7th of August, so she doesn't need a repeat. The really important thing about the MDT is that we can communicate face-to-face in a room. We have our surgeons, we have our pathologists, and we have our oncologists, and we can just talk about patients face-to-face and just make sure that everybody's getting the very best care that they should be getting.
It means that that patient's getting the benefit of not just my view or my experience, but the benefit of about 20 consultants' experience. We have to know what we're doing. We have to know what we don't know and be honest about it. I think we have to be skilled in communication, both internally between ourselves and with our patients, and respect each other.
And then we have breast care nurses who are absolutely crucial in supporting the patients. They actually follow the whole pathway. So they know their patients, whether they come to surgery or chemotherapy or radiotherapy, the breast care nurses are following the pathway.
So we know that it's a very small cancer that's been found, and we know that it's treatable. And I think if you take nothing else away today, we can treat this.
Yeah. Thank you so much for your help.
Oh, you're welcome.
Different patients will have different needs and different perspectives, so it's important to keep positivity, but equally it has to be measured and it has to be at the right level appropriate to that patient.
Nurse specialists in the MDT are the voice of the patient, and they often bring the important information about social situations or other views that the patients express to them. I guess you've seen more of the hospital than you really want to recently.
It's true.
Yeah, it's a difficult time. So what I wanted to talk with you about today is really where we go from here. And as I said, I know about the surgery and I know about the results from your surgery, which were very good indeed. A very small, early, low-grade cancer, from which you should do extremely well long-term.
That's excellent. Yes, thank you so much.
You're very welcome. It's been nice to meet you. And let's get you through this and out the other side, happy and well.
What we're aiming to do is enable them to go back to their life and not have to come back to hospital. So if a patient leaves the consultation and says, with all due respect, I hope I never need to see you again, then that to me is we've achieved that they're ready to go out and carry on living life.
I feel I've made a difference in a little way to somebody's life, and it's a privilege to be with people at the very dark times in their life and to be part of that.
That really comes back for me to that individualisation and the humanity. You see the person, not the cancer.
And the fact that you are doing one-to-one human interaction, you're responsible for their care. I think as much as a responsibility, but at the same time, it drives you as well.
So if I can't bring that ability to feel with them, I couldn't do this job. It's now a year since her treatment for early breast cancer, and I was pleased to find her well. She's had recent mammograms which have shown no sign of any recurrence or new disease, and she reported no symptoms of concern. Please be in touch if you would like us to see her again sooner than that. With best wishes, yours sincerely. Letter ends.